Good afternoon. I'm Scott Hara with UMHS, and today we are speaking with
Dr. Marume.
Dr. Marume recently matched into Thomas Jefferson University in Philadelphia in internal medicine. And I want to wish you congratulations. And can you please tell me a little bit about how great it must feel to have finally matched?
Thank you so much, Scott. I'm so happy to be here today.
Sure.
It's definitely an amazing feeling to go through school at UMHS and be part of the UMHS family, and finally coming to match day, to having that good news, matching into my desired internal medicine program, the Thomas Jefferson University Hospital internal medicine program, and being surrounded by the faculty and the UMHS student body while receiving this amazing news has been such a special and memorable moment in my life that I'll definitely cherish forever.
Okay, great. And you actually graduated last year in 2022, but like a lot of people, you took a year off and decided to come back to UMHS to teach. And you were the first graduate to ever come back to teach and have been teaching as a clinical instructor for preclinical services since July of last year, teaching both first and second year med students. And what have you liked the most about teaching at UMHS?
It's been such an amazing opportunity and experience to be able to come back to UMHS and to be the very first student to ever come back and teach has been such a special moment for me. Being with my mentors, the very same professors who taught me, and now being able to call them a colleague has been such a memorable moment for me. I really have enjoyed teaching from a very early onset, from when I was a medical student. Therefore, coming here and being able to impart the knowledge that I've obtained throughout my clinical rotations and throughout my experiences in clinical medicine has been such an honor to be able to see the students also grow their knowledge and be able to give them some tips and tricks to be able to get through the board exams that we have to write, the USMLE STEP exams. So imparting that knowledge both in a clinical aspect in the environment, and then also being able to apply that knowledge with some of the basic standardized exams, such as USMLE exams that our students have to take, has definitely given me an opportunity to grow my knowledge, and at the same time to work with the students to just give them that opportunity to be able to see what a UMHS graduate looks like once they complete their education.
Okay, excellent. And I know that during the COVID pandemic, you helped many students with distance learning, and that's actually how I first came to know you. We did a lot of interviews together, like over the internet, about distance learning when everybody was so scared and everybody was, sheltering in place. Can you tell us a little bit about what that experience was like for you?
Definitely. It's interesting how sometimes in life we're doing certain things and we don't know how beneficial they will be for you in the future. And as for me, with my passion for medical education, it really started in the anatomy labs when I was a teaching assistant for various semesters. Being able to be an anatomy teaching assistant helped me interact with students from various backgrounds and understanding how to impart knowledge and teach and learn at the same time. Using this experience, I was able to try and think about how I can impart this knowledge for students in an online setting. And during the COVID pandemic, that was one of the biggest challenges that students had. They did not have that interaction with their professors in person, and having to adjust onto a Zoom learning platform was definitely something that they found a bit challenging initially. I was able to use my experiences from teaching various modalities, both in person and online, to start the MedTutors website. And this website has been able to give me the opportunity to reach out to students beyond UMHS and help students preparing for their examinations on an online platform. This definitely helped me to touch and help a lot of students. And at the same time, I didn't know this, but it was building me up for my experience to eventually come back to UMHS and teach So one thing I can definitely say is in life, you don't know where these experiences are going to take you, but coming full circle to this moment, I now realize that this all happened for me to come back to eventually teach at UMHS.
Absolutely, that's great. And I know you helped so many of our students during the pandemic, and we're very proud of you and grateful to you for that. Now, Dr. Marume, let's talk a little bit about your upcoming residency. What are some of your short and long-term goals from your residency, and what made what made you want to choose this residency in internal medicine?
Internal medicine definitely has the same aspects of work and life balance I've been looking for. The ability to be able to take care of patients in an inpatient setting and to also contribute to the medical education of medical students and residents is definitely something I've always been yearning for and looking for into a residency program. I'm fortunate that the Thomas Jefferson University Hospital Internal Medicine program has a medical educator track for internal medicine residents that are interested in teaching. This gives me the opportunity to be able to also teach the first and second year medical students in a similar setup to the way I've been doing so as a clinical instructor at UMHS. So I would say it's definitely what I think is a perfect match, because I'm able to impart knowledge onto medical students, at the same time learn how to take care of patients in an inpatient setting. Therefore, I look forward to in the future to continue in this kind of format, and I would love to be a clinician educator who's able to take care of patients and also teach medical students and residents as I continue my career in internal medicine.
That's amazing. That sounds like it's a residency that's really tailor-made for you. That's incredible. Just out of curiosity, what made you decide on, when you were looking at medical schools, on attending UMHS in St. Kitts over other medical schools?
When I was looking into medical schools, I was definitely looking for a school that had that sort of family feel. And that was something I definitely noticed when I came across UMHS. I honestly came across UMHS through the blog posts, and I saw the UMHS Endeavour blog.
Oh,
and
wow.
I came across the blogs that are written by students, just kind of detailing their experiences on the UMHS campus. And it was very interesting. I was able to follow their experiences from their first semester, going all the way to the fifth semester, transitioning into Portland, Maine. And it gave me a sense of what the day-to-day life is like at UMHS. Once I had the opportunity to follow some of the stories in the UMHS Endeavour blog, I kept looking forward to seeing the next post, and I finally was able to attend one of the live webinars by President Ross, and just being able to see and interact with the faculty, some of the students and alumni as they share their detailed experiences made me so much more comfortable with this decision. The school has really made a big effort to create a campus that is very student-friendly and to have really good student and faculty ratios to ensure that students have that one-on-one time with the professors and teaching assistants. And I was able to have that feeling of this is a family unit, and it just made me want to be more and more involved with the school. By the time I watched that live webinar, I was pretty much on the next steps of completing my application. And honestly, I would say this, the school has done so much for me, and I definitely would not be here where I am today if it wasn't for UMHS and the teaching and the camaraderie and the family unit they've provided for me to allow me to grow.